Hello, my name is Alison Schofield and I am Clinical Manager at Mole Digital. I am also a tissue viability nurse and currently hold an honorary contract at York and Scarborough NHS Foundation Trust. And I'm delighted to be here today to have a discussion on a condition called hidradenitis suppurativa, or HS as we will call it throughout. Now, HS is a chronic inflammatory follicular disorder which causes scarring and develops painful lesions with lots of exudate and odour and various other symptoms for the person with this diagnosis. The onset is after puberty, affects a lot of younger people, and has either a delayed diagnosis often or misdiagnosis as well. So I'm privileged to have with me Suzanne Moloney. Welcome, Suzanne.
Thank you very much, Alison. I'm delighted to be here.
Now, Suzanne has her own journey through HS because she has this condition herself, and has gone some way to help others who have the condition as well in the development of particular products, and we're gonna discuss that. We're going to talk about that as we go along and explore into HS, because largely the wound care management has been mismanaged really and misunderstood for many years, and so we want to raise your awareness of the condition and to get some better treatment and management for our people and our patients out there. So Suzanne, can you tell me, first of all, tell all of us, how old were you when you were first diagnosed with HS, and what were the first signs and symptoms that you had?
Yeah, so, well, I was about 12 or 13 when I started getting symptoms of HS, but I actually wasn't diagnosed till I was 23. So it took around 10 years to be diagnosed. The first symptoms or signs that I had of HS was lumps essentially in my bikini line. And, I was going through puberty, my body was changing, and you're kind of at an awkward age anyway. So I thought there was something really wrong with me when I was discovering these new lumps. And actually, I don't. It's so sad because I actually thought that I had an STD or an STI, even though, I was a child essentially, and there was no way that could be the case. You're just learning about all of these different things and not realizing or not knowing what was going on with my body. So these lumps would form. They were like abscesses essentially. They would come and go in along my bikini line, my bikini area, and they would drain, and then they'd resolve and they'd come back. So it was kind of a recurring abscess in my bikini line. And there was multiple abscesses. And over the years, it got worse and worse. I hid it for years from my mother because I was so ashamed of it and embarrassed. And I was just really unsure of what was going on. And when I was about 17, it got really bad and I was actually quite sick with it. I had an infection. So I showed my mother and she brought me straight to the doctor. So I think that answers the first part of that question.
Yeah, that is so young, isn't it? And I know somebody I spoke to recently said, she was 10, her onset of puberty was at that age. And, we all know how it feels during those years and the teenage years, and to have that added extra of, what you were going through. And, as going through then in early adulthood, and it must have had some impact and effect on, or it does for people, on relationships.
Yeah, absolutely. So I was always, I suppose, firstly, I was always a really sporty kid, and I played rounders, and I was quite athletic, and all of that tapered off as my HS got worse and worse. Now, I still didn't know it was HS, but I was kind of dropping out of things. So I stopped being, stopped playing hockey, for example, and stopped playing rounders. I was limited sometimes in my ability to do things. I stopped swimming because I was too embarrassed to be in a swimming togs. In terms of relationships, definitely I was always kind of shy around boys at a young age, and yeah, it probably did impact my self-confidence, my body confidence, I used to wear, and still do wear, a lot of baggy clothes, and wouldn't have the same, I suppose, self-confidence as a lot of my friends. And yeah, it does impact things. You're shy, you kind of retreat from people. You don't like being hugged too much because there's a sense that I'm the smelly person, even though I know I'm not. When you're flaring and you have a lot of exudate, there's always that in the back of your mind, like, oh, can they smell me? So yeah, it definitely does impact intimacy and relationships and friendships.
Yeah, and you mentioned there like the exudate, and when the lesions, the flares are active, and I'm right in saying the condition flares up and then it can flare down, but some of these flares can go on for quite a long time and produce a lot of exudate. And how did you manage that? And an odor you mentioned as well.
Yeah, so there's definitely a misconception around HS being a hygiene issue, and it definitely isn't. And I'd argue that people with HS are obsessed with washing and bathing and showering because of the kind of stigma attached to that exact thing of being the smelly person or being seen to be unclean. So I definitely wash, and did wash a lot over the years. Like I'd have a bath every evening. I used a lot of antimicrobial washes. I'd carry wipes with me anytime I was out. And then in terms of trying to manage the exudate, that was just a constant struggle. There's so many off-the-shelf dressing products like adhesive island dressings or non-adhesive pads with tapes and things like that, but trying to keep them in an armpit or in your groin where there's hair, there's moisture, you're moving, it was just impossible. So I definitely have tried so many different things. I'd be cobbling together dressings, I'd be using bandages, I'd be taping things, I've used sanitary towels, I've used panty liners in my clothes. I've at one stage, I remember just one particularly bad flare, I was just housebound because I was so leaky that I couldn't contain it. And I said, you know what, I'm just not even going to leave the house until this is resolved, because it's just too much. You'd be draining onto your clothes, onto furniture, things that the ordinary person wouldn't have to consider. Like if I sit on this sofa, it's a grey sofa, am I going to leave a stain on it when I stand up? If I'm staying in, say, a friend's house or in a hotel room, am I going to leak all over the bed? Am I going to drain into my clothing? Will people see if I'm out in the shops or out for dinner, if I'm out, playing sports or doing anything? What can I do to cover this up? And it was just a nightmare. Adhesive would be constantly like giving me rashes, and taking a big island dressing off your armpit that's kind of secured itself and then peeled away a bit as you move, and then restuck, kind of pinching you and then peeling that away. It was just always a nightmare. It was like waxing your armpit every day.
So I mean the wound management challenges they're enormous, aren't they? Like you said there about the skin stripping. So if you've got a dressing that's too adhesive, it's gonna pull. We're gonna call what we call it MARSI, the medical adhesive related skin injury. That overuse of adhesive, which causes that excoriation. Dressings that just dry out because they've too much exudate and then they stick. And then that epidermal stripping on removal with that. Is something absorbent enough, like say leaking onto the clothes and retaining dressing, because these are difficult. I mean, I know within my role of managing wounds of all types, whenever there are wounds within the axillary area or in the groin area, places like that, it's really hard. And you're not somebody who's, you're not bedbound and we're applying a dressing, you're active and out and about, So that retainment of dressings must be really hard too.
Absolutely, it is. And I've had multiple dressings slipping out, falling off. I had one particular incident where I was at a hen party and I was shaking hands with my friend's mother-in-law and my dressing fell out onto the floor. It was mortifying. And it just, I had another instance where when I was in work one time, I was teaching a class actually. I used to be a baker and a cake maker, and I used to teach cake decorating as well. And I had a huge group of people, you know, around a desk at a demonstration. I could feel the leak coming, and I could feel the dressing kind of wiggling its way out from my buttocks area down the leg of my trousers. And it's just so anxiety inducing, first of all, because like you just imagine everyone's looking at me, everyone knows, you know, and it's such a horrible experience. And trying to keep the dressings in place when you're walking, or you could be walking, say, you know, just from one place to the other, and you can feel the dressing slip, but you're not able to just stop and take up your top and readjust it. You kind of just start walking, like hunching over or clenching or doing whatever you can to keep it in place. So yeah, it's a nightmare. And like you said, the adhesive skin stripping is so sore, and the fact that you have to repeatedly apply them, it's not like a, you know, an ordinary cut where it's a couple of days and it's healed. Like this can go on for weeks and months, where you're applying and removing dressings, to the point where a lot of the time I used to just get into the bath and actually just kind of let them all soak up as much as I could and peel them off. So yeah, retention was particularly challenging, and it's just another thing that the ordinary person without HS wouldn't have to consider, is that the dressing slipping and moving around. And also,
no, I mean, if I'm going out to an event or something, it's like, what am I going to wear? You know, how am I going to look in it? What lipstick you're going to wear, and things like that. To have to consider all that, and that fear and anxiety, you can see why people do then become very withdrawn and isolate with that. So during your journey with HS, Suzanne, when you went to the GP initially when you were 17, and it obviously took a long time even then to diagnosis, but when you were diagnosed, and I know you've had particular surgical treatments, but were you ever referred to a wound care specialist? You know, somebody like me, like Tissue Viability or particular clinics. Did anybody ever give you advice on that wound care management, which is such, you know, a big challenge for you?
No, unfortunately not. And the only time I was referred to a wound specialist was after surgery, so for post-surgical wound care, and they were after some really huge excisions where, you know, I was actually bedbound for about 8 weeks after it, or housebound. I wouldn't say bedbound, but I was fairly I was out of action, let's just say, for 8 weeks, and the nurse was coming to my home daily for the first couple of weeks, and then maybe every 2 days after 2 weeks, and then, you know, twice a week then thereafter. So as the wound kind of got better, I saw the nurse less. But no, and it's something that I always wish I had been, or even that the nurse that was taking care of my surgical wounds was able to say, oh, I think that might be HS, because these areas and what you've described to me, I think that could be HS, and maybe you should mention to the doctor, because I was having surgeries on these even before I was diagnosed. And it was actually a colorectal surgeon that diagnosed me, because he'd been doing so many surgeries, and he was like, this just is not right. So yeah, I wasn't offered any advice or guidance on how to manage the exudate. So for the most part, and I was managing this myself at home, and spent hours trying to figure out how to dress these armpits. I wanted to live my life. Like, I didn't want to be kind of sitting at home, you know, feeling sorry for myself. I've always been a go-getter, and like a lot of people with HS, you don't want this to impact your daily life, but unfortunately it does. And so you're managing this at home. I'd go to the doctor, get some kind of treatment, whether it's an antibiotic or an injection or whatever treatment you're offered. And then once I was under the care of the dermatologist, I was getting therapeutics and surgeries, but in the time in between my doctor's visits, you're kind of on your own and just trying to cobble together things and figure out how to dress these wounds as best as you can.
What would you like to see change then in clinical practice? What can we as clinicians do better?
I do think the provision of tools to help patients manage their condition is really important. And that could be an effective way to manage your wounds. It could just be maybe a referral to a mental health expert, because a lot of patients, because of the isolation and kind of going into themselves a lot, they do develop a lot of anxiety, depression. There's a higher rate of suicides among people with HS than the general population, and in particular women, female suicides. So there's this huge impact on quality of life that could be improved with effective counselling and effective tools to manage, to help patients to just live their lives as relatively normal as possible.
Yeah, and do you know, I think a lot of people, they're unaware, and I know because I've been presenting to educate on HS for over 6 months now at different conferences around the UK, and I would say, and we've had 1,500 people about so far to present to. And I would say there's about 50, because I always ask, are people aware of the conditions? About 50 clinicians so far who have said, yes, we are aware, and we have seen people with this as patients or people, you know, within their own family. That's really low number in terms of clinical practice. You know, I think just by like this, we're talking about it, you know, to raise that awareness, then hopefully things will improve. But
the other thing I think would be really helpful for clinicians to know is that, like, when you see the patient, I'll just give you an example from my perspective. I will have a flare and it will be really bad, and I'll try and manage it as best as I can at home without having to go to the doctor. I, like so many other patients, feel like a burden to the clinician because we're always, you know, sick. You know, it's kind of this, there's always a flare up, there's always pain, there's always something. So I try to put it off as much as possible, and then I'll make it so maybe 50% of the time I'm not able to cope with it by myself, so I have to make an appointment and I'll go to the doctor, and that doctor is just seeing me at a certain point in time along the whole progression of the flare. And or maybe by the time I've gotten my appointment, the doctor, the flare isn't that bad anymore, and the doctor's like, well, I mean, I'll give you some paracetamol and we'll go from there. So I'd love to just show you a quick video of what it's like, and what sometimes looks pretty innocent, but actually underneath it all, it is quite leaky. There's a lot of exudate and a lot of leakage. So I'll show you this video now just to explain, or try to explain, what I'm talking about. So I've got this up on screen now, and you can see the skin there looks pretty innocent, but when I press down on it, because there's so much tunneling underneath my skin, the exudate is kind of pooled there, and it just drains. So it drains throughout the day. So when I'm walking, that will be leaking, or if I, you know, stand up or sit down, or with any motion that pushes that fluid out of the body, it leaks and drains. So I suppose from my perspective, or from the patient's perspective, just to be aware that what you're seeing might not be the worst of it. It might be, it might have been a lot worse a few days before you saw the patient, or it might be about to get a lot worse because some flares build up over time. And a lot of patients hide their symptoms as well. We downplay it because we feel like such a burden. You're kind of like, oh no, I'm actually fine. And oh, it's not that bad.
So we know HS isn't an infective follicular disorder, it is inflammatory. But as with all breaches to skin integrity and, you know, wounds that are created no matter what the cause, we get bioburden, and bacteria likes to proliferate. Nothing better in a warm, moist environment. And HS typical areas of lesions are in the axilla, the groin, the buttocks, and, you know, perfect area for this and kind of that growth of fungal infections and things. So have you had that issue and problem of secondary infection?
Yeah, I have, and you're right, it's really hard as well to differentiate them, because a lot of the symptoms of HS look like infections. And I think that's why for the first couple of years, when I was going to the GP, I was being treated for skin infections instead of like an inflammatory response. But the first time I did go to the GP with my HS, I definitely had an infection. Like, I was very sick. I had, you know, fever, malaise. I was just completely lethargic. And again, that can happen with the HS flare-up as well. But what I've learned over the years is to have a kind of a range of what I know is normal for my body and how I react to a flare. And then as soon as something a little bit abnormal happens, like maybe there was a distinct change in odor, or like the pain was different. Sometimes in some of the infections that I have had, the pain has been really stabbing and sharp instead of the usual kind of ache. It's kind of, if something is out of the ordinary for me during the course of one of my flares, I'll be straight into the doctor actually in that instance, because I know this isn't something that I can handle myself. So yeah, I've had a few infections over the years.
Yes, so that's the problem with all wound types really, is that we sometimes think they are infected and they're not clinically infected, and then we give out antibiotics and there's an antimicrobial stewardship. And you know, if we kind of can manage things better from a wound perspective, it might go some way to help, you know, just with that exudate absorbency, and to kind of reduce that proliferation and you know, we can do that with non-medicated wound dressings these days, and to prevent secondary infections. So, you know, it's worth a try.
Yeah.
Yeah.
I just add as well, a lot of the times, in particular, like in around the groin and thigh, like when you have a dressing on, you think it's securely in place. And then by the next time you go to the bathroom or see the wound dressing, it's moved and your wound is actually in contact with your clothes, you know, that way. And there's all little bits of maybe there could be, fibers from your clothes in the wound, and it kind of it's just a sticky mess sometimes. So even like the difficulty in properly dressing the wound in those areas, from, I suppose, from I'm putting words in your mouth, but from a clinical perspective, it's important to actually keep the wound covered and not to have that dressing slipping around and stuff. So I think there's the potential for infections to happen because the wounds aren't even being covered properly. Does that make sense?
It does make sense, yeah. We still have to work on the principles of moist wound healing, even though, you know, it might be a different trajectory, but we still work with that. We still work on things like the Times wound assessment framework, because it will help to better manage, really. So yeah, it absolutely makes sense. I want to ask you about what advice you would give to other people, say you were just starting with HS or had HS and they're kind of not managing, like, you know, self-care tips and things.
Yeah, well, I think a couple of important points. One is that you're not alone, or they're not alone, and that there is loads of support out there, and it's important to find someone who you can talk to about it, because it's such a lonely place when you got a diagnosis. I suppose, first of all, you've had this for a long time and you've always wondered what it is. There's been trial and error with different medications and treatments. And then you get the name for it and you're kind of, excited because you've got a diagnosis and you know, okay, we're going to be able to treat this now. And then you learn that it's incurable actually, and that you kind of just have to learn to live with it. So getting support is really important, and being open about it with your family or a loved one or someone who you can trust, and being able to talk about the impact that it's having on you, because it's not just an abscess, it's a whole like spectrum of other things, like from your social life to your ability to work. All of these different areas of your life are impacted by it. So support. Then in terms of self-care, I definitely think not feeling guilty about resting is really important, because a lot of patients, a lot of people in general, you know, if you have the day off and you have a lazy day, you feel kind of guilty that you should have been productive, but your body needs to rest if it's healing. And you just need to take a break and acknowledge, sometimes I just need a nap, unapologetically going for a nap, you know. And I think nutrition is really important, to have a relatively balanced lifestyle of, you know, eating well, your fruit and veg, hydration, drinking lots of water, will help you in general health, not necessarily specifically cure your HS or anything, but it will help your body to maintain health. Products that I use, I like different topical agents for different stages, and I get them on prescription. I don't just kind of go off and buy things and use them willy-nilly. I have different kind of steroid creams for particular stages of my flare-up, and then I use different washes at different stages as well. I take a lot of baths. I find them very soothing in terms of pain relief. Sometimes the itch is out of control with HS. I personally get itches, really itchy at nighttime, and I think that's common, but I'm not sure. I get very itchy at nighttime if I'm going to have a flare-up. So I use ice packs. I wrap ice packs in a tissue or kitchen paper, and I kind of apply them in between my thighs when I'm going to bed, just to calm the whole area down. Sometimes I use heat packs or hot compresses if I have a flare that's coming to a head and I just need relief. That's the stage where a lot of patients would self-lance, and I'm completely against that, because I think it's too risky. You can introduce an infection. But that's the desperation that patients feel, and I've been on the cusp of it a couple of times, and I just stopped and did the hot compress to try and help that. I also, and obviously this depends on the individual, but I take pain relief when I need it, and I would have like over-the-counter painkillers all the time in my you know, in the drawer, in the medicine drawer here, where if I know that I'm having a flare-up or I'm about to have one and I have an inkling of pain, I'll take paracetamol as soon as possible, just to get something into my body. And then, like, if it's really bad, I'll go to my doctor. I think managing your pain in healthy ways is really important. And exercising, and it doesn't have to be going for a run or, you know, doing anything completely that's going to exert you, but just even moving, going for a little walk. Sometimes I do yoga. I can't do all the sports that I used to love, but I do try to remain active, just in a more gentle way.
What about things like, you know, just general day-to-day aesthetic things like shaving? I imagine is a real issue for you.
Yeah, it is. I actually, one of my armpits has no hair in it because it's been so surgically excised. There's just no hair growing here. So that's this arm. It's great. The other arm, I don't. Do you know what? I don't bother shaving it unless I'm going on a holiday or something, or, you know, if I'm wearing short sleeve tops in the summer, maybe I will. But I just think the benefits of not shaving it outweigh the risk of a flare up. It's just not that important to me. I have done laser hair removal in around my bikini line, and I do think that's helped, but I don't know categorically if it does help. I feel like it's helped me. I try to avoid shaving any areas where I think I'll flare, because it's just an added little bit of friction when the stubble's growing back, and, you know, it's just I'd rather do without it. But yeah, shaving is being, yeah, it's a challenge for people with HS, absolutely.
And when you mentioned like the itching, and when the skin, you know, goes into healing and then it's scarred and it's stretched and it's tight, does anything like emollients help in that situation?
I don't know, actually, is the honest answer. I don't think I've ever tried an emollient. I think I might have tried an emollient bath additive. Is that a thing where you pour it into the bath?
There is some which are additives, so there's kind of all different types. But I was just thinking the kind of that, you know, if it is sort of, it's become sort of more hard and things like that, it might you know, help with that in some ways. We don't know, do we? We'll give it a try.
No, we don't know, and that's, I suppose, could be an area of research for someone in the future.
So, do you think that HS affects a higher percentage of the world population than what we know it to be? Because they say, don't we, between like 1% and 4% worldwide. Do you think it's higher than that because of the underdiagnosis?
I do believe that. Yeah, I think there's more people with HS than we know, and I think that's going to change over the next couple of years with, you know, increased awareness, hopefully reduced diagnostic delay, and I think also this movement of awareness, this HS awareness campaign that's ongoing across the world now is so exciting to me, because if I'd have known something like this when I was younger, I honestly believe my life would be very different now. I wouldn't change anything now, but the knowledge that we can create something and change the future course of treatment and diagnosis for future patients, and to prevent them having to experience a lot of what the majority of patients today would have experienced due to the diagnostic delay is really exciting to me.
Yeah, I agree with you, and because when you look at, I mean, and you know, there was an Irish study done, and the Irish population, and it said the prevalence was 1.4% of the population. Now that is virtually equivalent to venous leg ulcers, to pressure ulcers. We know that from the burden of wound study that was done. HS wasn't included in that, so you know they get so much focus, and you know the wound care focus has grown. Yes, it's a big issue, we know that. So you know, to me, everything that's been done and that awareness raising, you know, is vital. It's so important,
especially when HS affects people in their youth and prime of life. I think that's the worst part of it for me, is it really gets you when you should be out enjoying your life and, you know, going to college and starting your career and maybe starting a relationship and having a family. They're the years that HS is the most kind of active and debilitating. And I would love a more dedicated service to help people, because it's just so debilitating for people in their prime of life. Their entire future life is affected because of this condition, and I think we've real opportunity here to make a difference.
I agree with you, and I urge people watching who work in the area of school nursing, you know, people working teaching, universities, schools, you know, all these areas where our younger people are, to you know, primary care where people are walking in, you know, saying they've got symptoms and things, is to make themselves aware and to keep that, you know, that message going and raise the awareness. So what's the next step, Suzanne? What's going to happen on the HS journey? How can we make a difference to patients' quality of life?
Well, I think one thing that I'm incredibly proud of is the creation of HidraWear, which is a wound management system that comprises of a medical garment and absorbent wound dressing pads that can be used with the garment. And this, I kind of invented this out of my own need for something to help myself. And then when I saw the bigger picture, I started talking to other patients online and seeing that they were struggling. And actually, they weren't just struggling, their lives were being really impacted by the lack of effective care for them. That's what kind of got me into this whole area of research and development and product development. And it's just that's I'm just so focused on this now, because I think giving the people with HS the right tools to manage their condition will be transformative. And we've had feedback on HidraWear saying that it's transformed people's lives in terms of body confidence, which is so important, pain reduction in terms of dressing related pain, and improvement of quality of life. So I'm incredibly proud of that, and I'm going to continue with my work in HidraWear to make sure that it's as accessible as possible to as many people who need it. And then on the other side, it's the awareness and the advocacy and the education across the board to, I suppose, bring HS up to a status similar to psoriasis, say, or in the wound care kind of community, to be as well known as a venous leg ulcer or other chronic wound conditions, because it deserves a place at the table with every other wound condition, because it's just as debilitating and it's just as devastating.
Yeah, I agree, and congratulations. You're doing an amazing job. You're such an advocate for other patients with HS, and with the development of HidraWear is going to go a long way to make a difference to people's quality of life. And then I have some sense of responsibility, and with other clinicians as well, collaboratively, because it shouldn't just sit in dermatology. This should be a collaborative approach, that we are educating each other, and we're ensuring patients are getting the best care and management that they can with HS. Thank you so much, Suzanne. Do you know what? This has been so interesting, and we're learning more and more. Like you say, there's ongoing data and audits and things, so things can only improve, surely.
Yeah. And just one last thing, I'd really encourage anyone who's starting out on their research career or journey to maybe consider HS and wounds, the HS lesions and wounds, as a research subject, because it's absolutely fascinating, and there's an opportunity again to have a really huge impact on the patients' lives in the future.
What an important point. Yeah, fantastic. So thank you all for watching, and I think the message is watch this space. There's more to come. Keep a watch out for information, advice, and more research studies that are coming around HS.
Thanks so much, everyone.